Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, this is a question we get quite often. Why does my shoulder pop, snap, crack? You know, snap, crackle, pop.
Yeah.
Why is it making noise, and is it something I should worry about?
Exactly.
So we're going to talk about what are the things that can cause it to make these noises, which there's quite a few of them. Then after that, we're going to show you. We're going to talk about when you should probably see the doctor.
Sure.
And then finally, we're going to finish up with just a few exercises you could do to maybe help stop that from
Sure.
cracking. So,
And old Bonehead's gonna help.
yeah,
Or
we used to
Bonaparte.
call him Napoleon Bonaparte, but now he's calling him Bonehead for some reason. So anyway, again, the noise in your shoulder is very common. One of the no injury causes is what we call cavitation.
Sure.
So you have a shoulder here. I'll go with this one that is still attached. And the shoulder, you have a ball and a socket, and this is all covered in a material, kind of a tough fibrous material. And within that material, there's actually gases that can form, nitrogen and carbon dioxide, and they can form bubbles and they can pop when it's like when you crack your knuckles, you're popping these little gas bubbles.
Sure.
So that's number one. Number two is snapping tendons. All right, we have tendons, and Brad's going to show you this. Especially your bicep right here, the muscle itself narrows up into a tendon.
Right.
And that tendon is in a groove. And that groove, it can actually snap out of that groove at times.
So
When there's a test we actually do for that.
We're gonna pull this off of here, and here's the groove that Bob was talking about, and this is our mock tendon, which
I'll
is
hold it.
There you go. Okay, and that's that groove. Tendon fits right through. That's a really nice model. And maybe people have actually felt this when you can see the tendon pops back, and then you move your arm again, and you can feel it pop back in the
snap
groove.
back and forth.
Snap, 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 snap. I like this, Bob.
Yeah,
This
there's
is really
other
good.
tendons that could do that, but that's just one example. So that's, again, a non-injury type thing that could happen. Number three is if you have what we call a loose shoulder, like a double jointed shoulder, your ligaments, you're born with ligaments that are very loose. If you're one of those people that can take their thumb and put it like on their forearm, that probably means you're loose ligamented, or what's another one, Brad?
If you go like this,
yeah,
your
like
elbow bends
Yeah,
farther than neutral.
right.
Hypermobility.
There's a good chance, if your bone, if you want to put it in there once, yep. If it can really slosh around a lot, it's not held in there tightly, that's going to give you a snapping and cracking and popping. And it's going to unfortunately wear the shoulder out too.
Sure.
So that's at the end of the video. We are going to show you strengthening exercises that you could do for the side. Now those are the injury. Those are the ones that are really non-injury. Now there's the things that involve what we call repetitive stress. So if you're using the shoulder a lot or over a lifetime, you can start to wear down the tendons of the rotator cuff. The rotator.
People who work overhead a lot.
Yeah.
That's a primary reason.
Or even if your bones are not shaped right, they can
Sure.
start wearing down the tendons, and that can cause some roughness of the tendons. Again, the muscles narrow up to be tendons, and that can give you noise. All right, especially when you're up in here and you hear that grinding, stuff like that. The other repetitive stress injury is just plain old arthritis. Now you've got a little bit of a covering over the surface of the bone here, what we call hyaline cartilage, and after a while that can wear away.
Right.
And instead of this being nice and smooth, feel how smooth that is.
Yeah. Right.
It's nice and smooth. After a while, if you look on an X-ray of somebody with arthritis, it's all roughened up.
Right. It's like sandpaper, and you can just imagine that grinding against
Yeah,
the surface.
yeah.
And ooh.
Yeah, that one gives
Yeah.
the EBGBs, doesn't it? Okay, and the last one is an actual where you actually have an injury itself, and you just recently had an injury, and that could be, again, a rotator cuff.
Sure.
But it also could be what is called a torn labrum.
Right.
Within right here in the socket, basically, there's a little round.
Right. I got the pointer, Bob.
Oh yeah,
Use the pointer, huh?
around
Right on the
a
edge.
round ring of tissue.
Yep.
So if you took this right here, it'd be like, I don't know if you can see that.
Yeah, there we go. That's our model labrum.
Labrum, and it helps hold the ball in place. And
Yeah.
it takes pretty good injury to do it,
Right.
but you can tear that labrum.
Yeah.
And pieces of it can be floating around, and it's just not going to be smooth.
Yeah.
And that
No
one
fun.
could require surgical repair, depends on the person.
Sure.
You can also dislocate your shoulder. and might tear the labrum. Yep,
This is, my mother fell down and the x-rays looked just like this. Her shoulder, her humerus was way down like
wow,
this in the x-ray. So that was in the ER half hour after she fell.
wow, so they had to put it back in place,
Yep.
obviously, so those are the reasons why you might getting popping and snapping. So when do you worry about it, Brad?
That's a good question.
All right, that's number one. If there's pain with it, if there's no pain, you're in snapping, cracking, popping, fine, let it go. There's been no injury, just it's good part of life. You know, I will show you some things at the end that might help. If you've had a recent injury and now you're hearing popping and snapping, you may want to see the doctor.
Right.
Okay.
Especially if you had a shoulder surgery
Right.
and it kind of came up, especially if it's painful, but if it's not, then you might be concerned.
And the third thing I would say is if your shoulder always felt stable and now it doesn't, you're hearing popping and snapping, it feels kind of loose, like it's sliding all around, I'd probably see the doctor then
Sure.
too. So
Yeah.
those are your 3 guidelines. Now the things to try. One, the first one I'm going to put up a link, and this is just to help strengthen the shoulder. Some good TheraBand strengthening exercises. The more you strengthen the shoulder, the more it's going to help set it in place and keep it stable.
Specific exercises for the rotator cuff muscles.
Yeah, the
Keep
four
it stable.
muscles that go around the shoulder. And the last one, we're going to go ahead and have you pan back a little bit here, Lonnie. What I want you to do is find a surface, like a countertop. I can use the back of this chair. You want to move the skeleton out of the way, Brad?
An old bonehead.
This thing works out real well for helping set the bone back in place where it's supposed to be. What you're going to do is you're going to put your hand flat on the surface, a table or a countertop, and what you're going to do is pushing down the whole time. So if the chair wasn't there, I'd be pushing down like this. I'm going to push down and I'm going to walk away. I'm still pushing down, and I'm going to walk back to it again. I'm pushing down the whole time. I want you to do 5 to 10 of those.
Should be relatively pain-free.
Yep, and that's setting the bone down in the socket, putting it in a better position. And you know, what I would do is I would try this and then see if there's less snapping and cracking.
Right.
And, and speaking about snapping and cracking, snap that hand, baby, because we want you to slap that subscribe button.
Yeah, subscribe because we appreciate it and so do other people. So keep on snapping.
Slapping, snapping. All right, thanks.